having a bleeding disorder. My name is Jonathan James, and I'm the president and CEO of Hope Charities. And it is my pleasure to be able to invite you to join me to an important discussion about how to avoid or improve joint health over your lifetime. I'm so excited to bring you some amazing sessions where we're going to be talking about physical therapy, emotional well-being, prophylaxis treatment, and all kinds of things of how to improve your overall long-term joint health while still living with a bleeding disorder. 30 years ago, it was a common problem for people living with a bleeding disorder to have severe joint damage and crippling effects as a result of having internal bleeding. But today, because of treatment advancements as well as ongoing therapy and access, we don't see nearly as many of those problems, and the trajectory looks amazing for our future as a community. So I'm excited to bring you some amazing opportunities to be able to learn more about how to achieve that and how to do that over the long haul, because it's a long journey to be able to navigate some of those problems and some of those issues together. And I believe getting some of the people that have been living with it together to talk about this is the best solution to do that. So today I've invited a good friend of mine, Julian Borjas, to join me today to talk a little bit more about this event and how hemophilia has affected him and living with joint disease. So Julian, it is great to see you. Thank you so much for joining me for this pre-event podcast today.
Oh man, always happy to be with my adopted family at Hope.
Yeah, well, we love you around here. We feel like you're part of our family for sure, and looking forward to this event for sure. Tell us a little bit about where you're from and how you're affected by a bleeding disorder, and what you're looking forward to about this event coming up.
Sure. So I'm from Chicago. You can see the city behind me. Born and raised here. Born with severe hemophilia A. A few years after the bad blood crisis. So I am one of the older hemophiliacs, just by virtue of a whole generation being taken out. So I'm facing a lot of the problems of growing up that a lot of people my age do have with joint damage. Arthritis and joint damage actually affects us all at some point. It just affects people with hemophilia sooner. So it's always kind of in the back of mind. Even when I was a kid, the thought was, make sure that you get a job with good insurance and something that's easy on the body, easy on the joints. So it's always been part of my life and part of my concerns, my worries. But it hasn't stopped me from leading a very active lifestyle. And, at the age of 38, it kind of feels like a little bit of a long life as well.
It is crazy. I mean, I can remember as a young person, like being told that we might not even live a full lifetime. And now today it's possible to live a full lifetime. We just want to make certain that we encourage people on how to handle their treatment so that they don't have to live crippled ultimately in their later years for sure. And I think that that's really achievable today. I think that's very possible. We have kids today going to college that don't have even, even a single bleed because of prophylaxis treatment. So how do you think that people should consider, treating their joints so that the activities that they can do with maybe mobility, and exercise and things like that? What are the things you think have helped you to keep or maybe even improve your joint health over the years as you've learned more and more?
Well, as you can see behind me, being outdoors, being active has always really helped. I know we're always told to be careful about those activities, but especially nowadays, you hear people doing a lot more with their lives because of the access to treatment. So, the kind of restraints, the training wheels, so to speak, have come off the bike for a lot of individuals. And I'm kind of one of them. I lead a very active lifestyle. And motion is lotion when it comes to the joints. So, being outdoors, being active is very helpful. Being consistent with your treatment is has been helpful. And also just finding employment that suits somebody, even still with all the advances that we have, you're going to wake up with a bum ankle. You're going to have a day where you just can't get out of bed. And so, making sure that your life can accommodate those issues has been something that I've had in the back of my mind, and I hope that other people are too.
Yeah, that's true. And you've helped a lot of folks be able to learn how to modify their life and change their lifestyle over the years, working with Ethical Factor, as you've improved the lives of people every day by trying to help make certain that they get the best care they possibly can. So tell me a little bit about your work that you're doing now with Ethical and how you actually help people make certain that they get the best knowledge and the best care that they can.
Yeah, I mean, I'm going on 6 years with ethical coming in October, so that's a big
Wow.
milestone. I know, right? And so I would say that access to medication is something that Ethical Factor has. I always ask, what does ethical mean? It means to deliver a doctor's prescription. So we really do make sure that patients have access to care, and that makes a huge difference in quality of life. Because there's just those times, those rough seasons where you may not have as much access to factor, or you're not taking care of yourself. And every bleed counts, unfortunately. So making sure that we maximize just the benefits that are out there for individuals. Even when it comes to things like our scholarship program, that gets people into careers that allow them to have to deal with the mobility issues that they'll face, and to maybe have a chance at retirement coming up. And I can also think of just things like, battling with the insurance companies. We do prior authorizations, we do assistance with copays, and the different copay assistance programs out there with the manufacturers. So, I think that, and in the end, a lot of pharmacies will do that for you. Maybe not some of the big box ones, but a lot of the smaller ones. But that attention to care, that individual care, you're not seeing as many patients that are representatives, and it makes a difference because we can actually speak to some of the issues. We know how it feels to kind of want to disassociate from hemophilia for a little bit and fall off the wagon, but we try our best to keep our patients on product, make sure they're up to date with their insurance and all those issues.
That's so good. And I have to say, there's no better place to be able to have that regular care addressed with someone like you who has lived this day in and day out and really understands what it's like, even sometimes emotionally. I mean, I know, in years past, there's been times you're just dealing with hardship and transition, and maybe you've had some difficulty with your insurance or something like that. Being able to pick up the phone and say, "Man, I'm just stressed out," and if I can call you and say that, it really makes all the difference in the world, because you understand without me having to explain, years of backdrop, and getting another person who doesn't know my name, nor do they know my disease every time I call, right?
Yeah, that was one of my issues with some of the bigger box pharmacies. They constantly ask, and so when were you diagnosed with hemophilia? It was like, it was at birth, right? I came out blue, so
Right.
that was when they figured out something was wrong. And so I think that having someone who we really do develop that almost kind of adoptive family mentality. With my patients, it's like catching up with an old friend rather than a customer.
Mm.
And I think that that's a big deal when it comes to some of the emotional issues that come with hemophilia, because we're able to kind of relate. Like you said, there's just times when you're stressed and the last thing you want to think about is infusing, or the last thing you want to think about is your next shipment. And having a rep who can care and understand to that, and speak to that, I think is invaluable for a lot of, at least the patients under my care.
It's so true. Well, I'm excited about this session that you're going to be talking on working with mobility issues at Joint Health Conference coming up right around the corner on Wednesday, August 21st at 2:15 p.m. Central Standard Time. One of the things I love about these moments is people can join from anywhere. They could be in the hospital if they had to have a procedure done, or they could be at home, or they could be maybe in between classes at school. There is an opportunity for people to join anywhere, and you're going to be talking about specifically working with these mobility issues and all the ups and downs that you've experienced, and some of those really best practices that you've learned through the years in your own experiences, but also working with so many other individuals and families through the years in your career. So tell me a little bit about what you're excited about as it relates to this breakout session.
Yeah, I think that, a lot of times, we're told what we can't do. We want to
Mhm.
focus on what we can do, and kind of making your life built to suit you rather than, you're living your life with hemophilia on your back. A lot of
Mhm.
times we find people can see some of the benefits in the trials and tribulations that they go through. And I just think that that adaptability is, to get kind of into that work vernacular, that adaptability is a transferable skill, and being able to live your life, and continue despite what's thrown at you, is just a really good lesson, and we hope to bring that out in the program.
That's so good, man. I love it. I think it's going to be great. You always do such a great job at encouraging folks and getting people, really to understand what it means to be able to make improvements. Sometimes we think we have to make big leaps to improve our care, but sometimes just maybe joining the YMCA and going swimming once a week could make a huge improvement in getting that mobility that you need. Or maybe it's a modifying your job thing. How many people do we know? You and I've talked about this for years. We know that, man, they started out, even as a person living with a bleeding disorder, with a really labor intensive career path, and they learned how to modify, go back to school, or do something that they could to be able to get the treatment that they needed in their workplace and getting the right insurance. So I know you're going to do a fantastic job, and I can't wait to hear more about that. But you'll be available to answer questions. So if anybody wants to connect with you, they could do that at that session that's going to be on Wednesday. But also, they can join you in the exhibit hall and get to know some more about your organization and your company as well, which is really exciting. So, anything else that you would encourage people to do? How do they get involved? How do they learn more about this session?
Yeah, it will be present for the session and the breakout session. I think that it's always good to have different options in your back pocket. So if you're working with a pharmacy now and you're just kind of perusing around, definitely check out our website. Definitely ask around. I think sometimes with the community, word of mouth is great too. But we have representatives. We're in all 48, not all 48. We're in 48 states and throughout the country. So definitely make sure that you have that card in the back pocket, because with these chronic illnesses, especially hemophilia, sometimes our chronic disease can become really acute, and you have some kind of event that you need assistance for, and that's when you really want that personal care. It's somebody who is going to make sure that in a life or death situation, they're coming to your aid. So just keep us in mind and investigate and do your own research and talk to who you want to talk about, and I think we'll be happy to answer questions that you have.
That's awesome. Well, I know people can also go to the website at Hope-Charities. You can register for this event. If you have questions or anything, of course, please email us at events@hope-charities.org to learn more about this specific event, or how to, if you want to get in touch with Julian, that's a great place to start. You can email us there and we'll be happy to connect you there. But man, Julian, I just always appreciate everything that you do for us and for our community. And we want to say a big thank you to Ethical Factor for supporting this content and this educational opportunity for folks, because I don't think we would be able to do it if it wasn't for your help to do that. So thank you so much for all that you do for me and for our community and for all of us. And we're looking forward to seeing you very soon.
Thanks. See you soon.
All right. Take care. Make certain that you go by the website, though, and definitely register right away so that you can hear Julian's session, as well as so many more great sessions that we're going to be talking about at hope-charities.org. You can learn a lot more about all of the things that are happening for this event, which will be happening on August 20th and 21st. It's a live event. You have to participate in order to be able to be eligible for prizes and giveaways, which we love doing because generosity is our favorite. We'll be giving away $25 gift cards, $50 gift cards, $75 gift cards, and so on. We got so many fun things planned. It's going to be amazing. Matter of fact, I think that there's a grand prize at the end of each day for people who are able to participate in 2 or 3 more sessions. And those are really going to be amazing times to have a lot of fun together. You can learn about all of it together at hope-charities.org. Right there on the homepage, you'll see the joint health event coming up right around the corner. And I want to say another big thank you to Ethical Factor for helping to support this event and many other things that we do as an organization. So thank you, Julian, again for being with us today. Thank you, Ethical Factor. And we look forward to seeing all of you with us on August 20th and 21st. Go register right now, and we'll see you very soon. Take care now. Bye.